Hi and welcome back. In today's video, we're going to be covering the common mistakes that I see when people decide they are going to apply for hospital financial assistance. So we're going to go over some of the mistakes and the reasons why those are potentially mistakes, so that way when you are applying, it is less stressful. So let's get started. When you're dealing with a medical bill, oftentimes it's stressful, especially when it is a large amount. When it comes to seeing a bill that could be thousands of dollars and you don't have thousands of dollars to give, in that moment, you might start feeling panicked, you might feel stressed, you might be wondering what can you do, and so you'll have a lot of fear and anxiety, and all of that could potentially cloud your judgment and make you potentially make mistakes because you are all stressed out. So the first thing, as always, is open the bill, look at it, and then take a deep breath. Don't immediately go into, I'm going to problem solve this, because often or not, you will be stressed out and then you will overlook things that you could be doing or what you should be doing because you're just so in it emotionally. The first mistake that I commonly see is that people wait too long to ask for help. They will go, look at it, and then avoid it for months, wait till they get a letter from collections, and then be like, oh snap. When I tell you before about take a minute before you address it, I don't mean take a couple of months. You do need time to address it, and for some policies, you do have a max amount of time in which it could be retroactive, but you do need to just take a brief moment. Again, opening it, immediately seeing it, and then panicking, that's not the time. But a couple days later, better. A couple months later, you might be cutting it too close. So again, first mistake is waiting too long. You want to make sure that once you get the bill, you set up a time, could be a week from when you got it, to sit down and look at your options. Mistake number 2 is assuming you don't qualify. So do not disqualify yourself before they even review your information, because you aren't the one who determines whether or not you qualify for it. They do. So often I see people just assume that the amount of income they have is too far above, and then they don't even apply, realizing it's a sliding scale discount and they could have still gotten a discount instead of paying full price. Another mistake that I commonly see is people aren't paying attention to which of the hospitals they apply for. So when you apply for a hospital chain, each hospital within that chain will have a different policy. So if you accidentally are applying based off of one hospital's policies when that wasn't the place that actually gave you service, you could be in trouble. And by in trouble, I just mean that you would have to redo it, or potentially you may have missed out on some timing, because now you have to take that application and get it transferred to the proper department for the proper hospital in which it is being dealt with. One mistake is starting a payment plan before you even went through the other options. So a payment plan is great, yes, and a lot of people just immediately go for it. But if a payment plan is still going to cause you stress, and I would still ask about financial assistance. But a lot of people go, well, why do I need financial assistance if I have a payment plan? You can still do financial assistance with a payment plan, often cases. So you could be paying even less still, in a way that you can float financially without burdening yourself. So you don't just immediately have to accept the payment plan. You can ask about financial options in conjunction with doing a payment plan. Big mistake again is not tracking conversations. So if you are doing the follow-up, which I would hope that you are following up, you need to make sure that you are doing the tracking involved with following up. You need to write down who you spoke with, write down what they said. If possible, ask them to email you what they said, so that way you have confirmed receipt and you have in writing something that they told you, in case a rep accidentally gives you wrong information. You won't know that, but if you have it in writing, then you can put it in your case as to, hey, I was told this, that turned out not to be the case, but that is what I was given at that time and why I did this. And sometimes they can just do a ruling just because you were misinformed. Another mistake, not confirming that documents sent were received. This is especially important if the application is done either through an online portal in which you have a bunch of different sections. You want to make sure that your profile is complete, that they have all the paperwork that they require. Now, when you do it in a portal, sometimes they could see some, and then sometimes randomly will be ones where they'll be like, oh, it's not readable, they were unable to see it, or you missed a certain section. So you always want to make sure that you call to confirm that the paperwork received was correct. Now, when it comes to a paper application, you better make sure that you tracked it so that way you can confirm that they did receive it. And that way, when you call to ask them whether or not they processed it or put it within their system, or if it's now being up to review, you have information as to when they received it. Because if you just go, yeah, I mailed it, they're going to be like, I get a lot of mail. How do I know that we received it? Maybe it got lost in mail. Maybe you're just saying that you mailed it and you never did. But if you call and you tell them that, hey, this is the tracking number, they can pull it up on their own and see that it says, USPS, UPS, FedEx, delivered, and who signed it, then you have a better case. If you are confused about a bill, you can still ask to itemize your bill in order to make sure that the charges are correct. So that's something that you should do regardless of whether or not you're going to do financial assistance or not, because there's a lot of bundling of codes and it might not be exactly what had happened. Not checking your EOB, which is your explanation of benefits from your insurance, should you use insurance when you had these claims filed, is something that you should check. When you don't check it, then you don't know or see how it was processed. Sometimes a medical bill could have just been processed incorrectly, and instead of being in network, it was out of network. All you have to do is check the EOB to see whether or not it was in network or out of network. Then you can confirm by going to your insurance's website and putting in or typing in who you saw or the services received to double check to see if they are in or not. You will be surprised how often their systems will be outdated, or they accidentally will send you things that a provider was out of network but then in network, and blah, blah, blah. It happens frequently, and it is up to you to call them, your insurance company, and be like, hey, I just got notification that this bill was provided as out of network, but it wasn't. It was in network, and it was in network. I just typed up this in our website, and bam, it shows that they're in network providers, but this EOB said they were treated as out of network providers. Please, can I file a claim to correct it? They will do that. You can file a claim to correct it. They do have a separate process that is through your health insurance company, but that just, again, really is tied to whether or not it was processed in network or out of network. Another reason is to have it so that way you can compare the charges that insurance received versus the charges that the hospital is saying you received, because lo and behold, sometimes they're not equal either. So if they're deciding to charge you for stuff that they never sent to insurance, you could be like, hey, here's the EOB for the date of service. Here is what you are providing to me, hospital, as to what my charges are, and they aren't the same codes, so they're not lining up. Can you please either reprocess this and make sure that all the codes that you have listed is being sent to the insurance, or can you tell me why there's a difference and whether or not some of these have to be removed for being duplicates? Another mistake that I see commonly with people who are applying for financial assistance is that they accept the very first answer. So if they just get a denial paper, they're just like, oh, yeah, it was denied. That's not always the case. You can call and request information as to why you were denied and what process do you have to appeal the denial. Now, with my son, that's what happened. Giving birth to my son, I sent in the paperwork, and then they sent me a mail saying that they had denied me and that my income was too great. So I immediately responded back with, well, according to your policy, and I attached a policy in my letter, this is where I'm at. So here's my family's income. Here is where the federal poverty line is. Here's where my income is. And based off of your policy, I qualify for this amount of discount because my family size is this. How did you process it? And then it turned out that they had processed it where I had less dependents, but no, I have more dependents. And so when it was readjusted, bam, they saw that I actually was within income limits and therefore the discount could apply. That happens, especially if you are self-employed like I am, where they might be going off of your tax return from the previous year, in which case you might have been working the full year. In my case, I had a baby. I wasn't working the full year, and so my income was going to be less than the year prior. So those are additional factors that could come into play and things that you are allowed to discuss with them, so that way you aren't unfairly denied for something that you do in fact qualify for. Another mistake is not reading the policy and understanding what documents you need to send. In the application, it may list some documents, but in the policy, it may list additional documents that you may need. You want to make sure that when you are applying, you are giving them what they need. If you send an incomplete application, in some cases, they will automatically deny it. In other cases, it will start the case and help you. But you want to give them what they need. You do not want to make it further complicated and drag it out, because that will also stress you out. On top of then be more paperwork for them to have to track. And then if you're sending things in bits and pieces, then there's a bigger chance, I should say, of them losing it or not putting it in the right file. Make sure when you are applying that you give them what they asked for, and try to give them a full application from the beginning. It is possible to ask for help when you call to get these applications done. Hospitals have financial counselors who are able to walk you through the process or give you some tips. There's ombudsmen, like there are people out there who can help you with this process should you need it. Just ask for it. And if they don't, they may be able to guide you to someone else who can. But they're supposed to have someone who can help you to apply or explain something that you don't understand. And all you have to do is ask. Another mistake is calling when you are upset. It should be common sense that when you are talking to the representative, you want to not be screaming, not crying, not cursing. We understand that it's an emotional event, okay? Getting a shocking bill of thousands of dollars is an emotional event, but it's not okay to try to take it out on somebody who wasn't even privy to what happened to you. All they are is a person who can see some of the information on their profile, or on your profile, but on their computer. So you need to make sure that you can stay level-headed and calm when you're having these conversations. If you feel like you can't do that, when you are making these calls, ask if you're allowed to have somebody else there with you to be your speaker if you think that you won't personally be able to do that. It does happen, and that's okay. But you are entitled to give permission to let somebody else handle those affairs with you in those moments. So you don't have to super stress out about that either. And the final mistake is letting shame stop you from applying at all. It is okay to want to have a discount on your medical services. It is okay to, even with good insurance, still get a medical bill that is too much for you to afford. It happens. And there are programs to address that, because people are aware that in the United States, medical care is crazy expensive. So if you find yourself needing to use one of these programs, understand that that's why they're there, for people to use them. The hospital does get a benefit from being able to write off part of the expense. You get a benefit from not stressing out and having to pay a big amount and instead pay a lesser amount of that total. It is win-win. Don't stress yourself out. Understand that these programs are there to be used, and therefore it is pertinent that they get used. So yeah, that is just some of the common mistakes that I see. If you would like, I have a checklist where it's just like, here are these things. Did you double check? Did you make sure you saw all the documents? Were you sure that you selected the right hospital and the right policy? What are some ways that you can get more help? So if you would like a checklist like that, it is going to be in the School Community Unmuted Money. So there will be a link in the description and in the pinned comment. So yeah, I hope this is helpful. Just again, some things to consider when it comes to hospital financial assistance programs. It is something that I have personal experience with, and then I've also helped other people with. So it is something that is not as common as I thought. I thought a lot of people, or a lot more people knew about this, and they don't, because they really don't advertise it. And it's just, hey, it's part of my due diligence to spread the word and make sure that if there are people out there who don't know about these programs, that they at least have some information to help them gain more confidence to ask for it and get the assistance that they require. So yeah, if you found this video helpful, please give it a thumbs up, comment. If you have any questions, any ideas for a video, anything that you want me to talk about, you can drop it in the comments down below. Or if you're in my school community, I'm there every day. You can just ask me, DM me there. And yeah, as a reminder, I am a one-person show. So any of the comments you see down here is in fact me. So, take that with a grain of salt. There's no AI or anything, just me. And so I will try my best to answer any comment. And if there's something I don't know, I'll tell you that I don't know and where I would go to try to get more information. So yeah, hope that was helpful. And in the next video, we'll be talking about options for those who are uninsured to begin with. So hope it was helpful, and I'll see you in the next video. Bye!